Hello, Susie Ruse.
Hello, Stacey Harris.
This is so fun. Thanks for joining today. And a note to everybody coming in the room right now, thank you for joining. A lot of the topic today is going to be hidden revenue leaks in healthcare ops, but there are revenue leaks everywhere. And I usually ascribe them to being time thieves. So time is our most valuable commodity, and we deeply appreciate you all taking time out of your important day to come and listen to Susie and I have a little chat about her expertise and some of the things that we see that there are solutions for. And a lot of the time we don't know what we have to solve for unless we talk about it. And so today we will be talking about it. So thank you.
It's going to be fun.
It's gonna be fun. All right, Susie. You are a very humble, wonderful professional. So I would like to do you a little justice. But if anyone goes to Susie's LinkedIn and sees your skills are amazing, your roles have been amazing, our partnership I'm deeply value. It's one of the best partnerships that I've ever worked with. But I would love to take you back a tiny second, because when I look all the way down your experience, I see that you started with patients.
I did. I started as a respiratory therapist in the hospital setting, and yeah, patients were all day, every day. It's been a while.
And so that was the beginning. I would like to think of where you were like, how can I help even further? Which
Yes.
is kind of a similar story to Ian and George, right? They were seeing patients, but there's more to do, because only when you're in those seats can you really see that which can be improved upon and what the clinicians and the patients need most of all.
Absolutely. Yes. And I think it is that connection between like the actual experience of our clinicians who are doing the really hard, sometimes tiring, complicated work of patient care, but the opportunity to move into roles where I could have a greater impact at a bigger scale is what was really exciting. And that's the kind of work that is really transformative when you're doing this kind of work. So I'm really excited about this conversation.
Yes. And you have so much to teach based on experience, which is the best kind. Um,
Yes. Yes,
I
failures and successes.
think we only learn. They say there's really no such thing as a failure, only a lesson.
True.
Um, I love that you describe yourself as a multi-state expansion architect. I would agree,
Thank you.
but you literally, that intersection of healthcare growth, but regulatory structure that exists, and how do we move within the system that exists in the best way possible. A side note on included. So you started with Grand Rounds, correct?
I did. Yep, 7 years ago.
Okay. And they have changed rapidly. So a colleague of yours had put this is not my words, but she said Included Health brought healthcare to millions of people during a global pandemic, to integrating 3 companies to form Included Health, launched personalized all-in-one healthcare for a third of the Fortune 100. But the team consistently found a way to dig deep, solve hard problems, and push both ourselves and the industry forward. And I feel like that was a beautiful testament to Included. And I know you have been sitting in a main seat helping do that work. So if you want to start by just telling us a little bit about your role at Included and how you help all of these clinicians and then patients every day.
Yeah, absolutely. I have an enormous privilege of leading a small but mighty team that covers so much work. It's just when you start listing it, it's hard to wrap your head around. But ultimately, I'm accountable for Included Health's practice and our clinicians and making sure that we are managing the practice at the administrative level. So that is our clinician licensing, our credentialing, our delegated payer enrollment, our nurse practitioner and physician assistant supervision and collaboration, as well as all of our clinical onboarding, training, knowledge enablement. How do we make sure that our clinicians actually have the support, resources, and training to use our platforms and take care of our patients effectively, efficiently, and like really in a way that improves outcomes? So
Amazing.
it's a lot of work, and we love supporting it.
I think what's so fun about everything you just said is probably everybody in our room who's listening to today understands this. But think of the average patient walking into a clinic and seeing no one understands this back of the house, right? And so I think that leads us beautifully into this hidden revenue leaks, which thank you, Mockingbird marketing team, Katie and Casey, for this lovely topic and putting us together today, because the healthcare organization, ultimately, the revenue really is sitting when patient is with clinician and one large part of it. But how much happens to make that happen? And then along the way, even after that happens, they're licensed, they're credentialed, they have everything, all that ongoing part, whether it be education or new regulations. So I guess the first question is, how is the transition from hiring that clinician to fully activating them? What's like best process for you there? Or where are those hidden gaps for anyone to say, oh, we should stop and really look into that, because this is a place that people get hung up?
Yeah, I think you're so right that this is like where things get really complicated. And there's so many different teams and people touching every single clinician to make sure that they are ready to practice, fully capable of providing as much access to patients as they can. But that creates seams, right? Like you have different people doing different things and different teams reaching out to the clinician at different times, asking for different things. Like things fall through the cracks. It's not the best clinician experience. One team might have no idea what kind of information the other team is collecting, and maybe it's completely duplicative and inefficient that we're all collecting the same information at different steps. So I think just recognizing and really taking the time to map out your process from start to finish to understand what it actually looks like is probably a little bit underrated. And maybe like it's one of those things where, like, when we talk about time being one of our biggest commodities, that takes some time and you have to carve it out to really understand where you have opportunities and where you can improve your clinician experience and maybe where you can reduce the turnaround time to increase their access to patients and members.
I love that. And again, we've talked about your experience, your passion for this. Like my head goes to brand new company,
Yeah.
new model, folks who are jumping in. We're organized. We've run offices before. We understand a little bit about this. It's not really enough, right? You have to have these subject matter experts who know this. I would imagine that people kind of start out and then maybe get stuck and
Mhm.
growth stops. And this is where then you have investors and a lot of other people be like, well, what's going on? You don't see, you don't see. And I
Mhm.
think that when you first said map the process, like I think if anyone's watching this, to take a takeaway of that should be in the beginning sessions of planning. And I don't think it is. Like we have a lot of folks that come to us like, this is with duct tape. This is, we didn't even know we had to do it. We put this on the clinician. And I think one of the best parts of included is the first thing, maybe one of our first meetings, I don't know, 5 years ago, you said to me, we try to handle as much as we can for the clinician. And if
Yes.
there was a takeaway of why I do what I do every day, it's to make the clinicians lighter. It's to give them less. And I continue to hear that's the clinician's problem. Or no, the clinician does that. And if I could scream, it would just be like, no, guys, talk about a revenue leak
Mhm.
is putting anything on the clinician. So talk to me a little about that, from the process of the clinician, how little you really want them involved and how you're able to guide that.
Yeah, yes, I love this question because it's a hard thing though too. I mean, and it's not something that you can flip over to that in a day. I There's still a list of things that I would love for our team to be able to support more fully and do more and take this from the clinicians and it's just continuing to push that forward and taking it one step at a time. And I do say just to anybody that is feeling overwhelmed by this or feeling like, wow, we don't do anything for our clinicians and I feel like I need to change that immediately. I think being transparent with your clinicians and expressing that and them knowing that this is what you want to do, even if you can't do it all in the next month, goes so far. So just expressing that and keeping your clinicians kind of on that journey with you so that they see that there's effort and there is intent behind moving towards that is so important. Um, I think that there's so many things that we ask our clinicians to do, even just from the time they might sign an offer letter or a contract to their day one with you. We
Yeah.
ask them to do so many things. We ask them to send us so many documents and answer so many questions and start working on so many applications. And it's just so much that anything that we can do to reduce that burden and set them up on day one to be able to focus on learning your systems, learning your platform, and then ultimately providing patient care as quickly as possible and in the best way possible is so worthwhile. So and I do think that's why mapping the process, like
Totally.
it just definitely supports that because you might identify, and actually, this was something that our team recently did. We remapped our process because we have gone through so many iterations of it over the years. We've changed things that we do that we actually stopped and mapped things out from start to finish. Again, just to reevaluate, and we identified that we were actually looking for and pulling the same documents. Like we license verified people 3 different times on 3 different teams. Whereas,
And you
like,
didn't even know until you took a moment to
yep,
slow it down and take that whole process back.
yep,
That's amazing.
exactly.
And
So,
then you think of it from the clinician, they're like, we already gave you this.
right,
And
right.
that's where the frustration starts.
Mhm.
And then the next question, they just feel probably like something else, even though now it is something else. And really checking that what you're using your time with them for is truly valuable.
Absolutely. And I think it goes to your credibility as a team too.
Mhm.
When they're being asked by 3 people who from their perspective are all on your team, so they're all
Yeah.
part of the same team and we're all asking for the same documents, that degrades their trust and experience in our team. And luckily, I have incredible people on our team who are so expert at what they do, and their interactions with clinicians helps to soften some of those seams that we might not have worked out completely yet. So I think that's my other push is invest in your individual people on your teams and let them be experts in what they do. And as much as you can, give them an opportunity to actually interact directly with the clinicians, maybe even like getting on a call with them, not just interacting via email, because those relationships, I can't tell you how many times I hear about how amazing the licensing specialist has been. And like, I never would have made it through this without them getting on a call with me and working through this with me.
I love that. And that's everything. I mean, that's building the relationship.
Yeah.
And I think, there's sometimes the organizations have so many layers. So the one office will say, oh, well, we have these, this team manages the clinicians. But the more layered any of us are in our jobs, the further we are from the main impact or the understanding of the why. I always think people say, never forget the why, right? And you included health does a great job of why and what they're out there solving for. But the clinicians' why is almost always just the patient.
Yes.
So to sort of find a way to marry these clinicians who, thank goodness, are focused on patient care to the larger organization and all the people that are in it with them for them is culture.
Yeah.
And culture is built on transparency and communication, but it all comes back to the time, which is our most scarce, commodity. And so how do you fit it all in? So
Yeah.
this is off topic completely, not on any of the papers from our stuff, but that's how you and I usually roll anyway.
Yes.
What kinds of things, maybe, like you said, even if you're not doing it yet, do you think are really team building, especially for the clinicians who don't have the time? How do you cultivate culture and sort of nurture that? They're probably not going to all go on an offsite in
Mhm.
Aspen. Like that's probably not going to be a thing that could happen because who's taking care of the patient? So what ideas do you have there?
Yeah. That's such a good question, especially as we continue to be like even more remote countries where
Really?
companies
Yeah.
across the country where like included you have clinicians in every single state in every single time zone working different shifts. It's just so different. You don't have a staff meeting at 7 a.m. before surgery starts to really get everybody on the same page. You lose that opportunity to have hallway banter and develop those relationships. um, I do think it takes so few personal connections to change the culture, though. So one of the things that I talk about, and I love included, we are just, I don't know where this came from. I don't know. I don't think it's anything anybody purposely said we should be doing it this way. But I don't think I've been in a meeting in 7 years where the first 5 minutes of the meeting was just like, what have you been doing this week? How are your kids? Like, oh, how was your vacation? And like, I can't wait to hear all about it. Or how's your new baby? I know you just got back from leave. And doing that with our clinicians, even if it's somebody on our credentialing team who's reaching out to like clarify something on a call, like having that first
Huge.
goes so far. It goes so far. And if you just have a couple of interactions with different people on different teams like that as a clinician, you see that continuity and this is the way we operate. And you care about me as a person, not just a commodity.
I love that. And I think that's a great takeaway. Again, to whoever's listening from this, you have to meet people where they are
Mhm.
and see them for who they are. And first and foremost, right, the same care that our clinicians are giving the patients, if it's, hello, how are you?
Mhm.
It's so great that you guys are mirroring that all the way around. And I think it speaks to the loyalty. I mean, you
Mhm.
have very strong, loyal clinicians and a team. One of the things that Mockingbird will often say is like, we'll be here when you call, right? Knowing that in a very fast changing world, and a lot of people zip off. So I think that's it. And talk about revenue, um, securing, right? Keeping your people.
Yes.
I always say it's, and they do talk about the cost of losing a clinician. I can't imagine what
Mhm.
that next onboarding is, but there is probably one of the best things we can all do for revenue is just keep our people
Yeah.
happy and thriving and growing. And I think that growth mindset that you definitely come to the table with as a leader of what you've tried to do and expanding, I think that can lead us into the next place, which is the other, again, regulatory agencies are what they are. They've been what they've been. There's some innovation around, but talk to me a little bit about that space and how you see that evolving.
Yeah. I think you mentioned it at the very beginning of the webinar is like the reality is like regulations are what they are. They may not be where we envision and dream for them to be for healthcare in the next 5 or 10 years. Like hopefully we're getting there, but we have to meet them in the meantime.
Right?
So it's like figuring out how do we stay within these regulations and meet all of these requirements that are totally different from state to state and often just from state licensing board, even within the same state. They're completely different. So, how do we reconcile the fact that that's just reality and really identify? I think the biggest thing is identifying what's in your control.
Mm-hmm.
And that's what I try to talk a lot with our teams about is yes, we have no control over how long it takes for the Alabama State Board of Medicine to issue a license after they have everything. I can't do anything to change that right now. Let's focus our effort, our process improvement, our expertise building in everything that we can influence, which is how quickly we gather documentation, how efficient we are, how quickly we are able to gather additional things, how easy we make it for a clinician to get fingerprinting done if they live in a rural area that's an hour from the closest sheriff's office.
Mm-hmm.
All those things are things we can influence. So while we're waiting for regulations to make it easier for us to get our clinicians licensed and seeing members faster,
Yeah,
that's what we focus on.
I love that. And then that comes back to the culture of working at Included. Like you guys are going to control the things you can.
Absolutely. Yep,
Um,
absolutely.
what I feel like I'm looking at the clock. Katie, I have you in my ear. I think we'll wind down with a couple final questions, but one that I kept thinking about is Susie Ruse closes her eyes and let's make it 2030. Not that far in the future, but just far enough, right? We see the role of AI coming in. Like when you mentioned, what else could we do for a clinician? All I could think is, well, maybe Elon will give us some robots and each clinician will have someone to fill it all out for them, attached to their heads. Who knows what the world's going to look like? But you're a clinician and you're starting brand new at a brand new organization. What would the perfect onboarding look like? Where your teams, I mean, this is out there, but is it all done for you? Was everything done sort of at the interview process? Like, where are the gaps that, again, this assumes you can control things that we know you can't control?
Hmm. Yeah, that's a great question. Dream big.
What
I
else is there?
I exactly. And if we're not saying this is what we want it to look like, other people are going to decide that for us, right? So I think if I'm dreaming about what it could look like for a clinician, it starts with them walking in on day one with totally clear expectations of what's coming. There is no misalignment. We did a phenomenal job of explaining to them what is going to happen, what licensing is going to look like, what our expectations are of them in that process, because my opinion, there should never be a period where they are not part of that in some way. They have to be looped in. These ultimately are their licenses.
Yep.
They are responsible for them legally, and we want to set them up to manage them efficiently, effectively, and know what they're getting into. So that to me would be number one. Everybody's on the same page on day one about expectations on both sides.
I love that. And I'll take it. I mean, sort of some of the work we're doing at Mockingbird is having that all be organized for them for their whole career. So having them really be able to say, oh, here I am, and here's everything I've done, and here's everything that you could need. So this scramble for information is not in place either. And I think that is just getting better and better with technology and some of the other, avenues we're going. Um,
Yes.
this is a question that just came in. What are some of the earliest signs that an organization's licensing and compliance processes are becoming an operational bottleneck?
Oh, I love that
Woo!
question.
Good.
Oh, that's such a good question. Okay. I would say ultimately the first thing that I would look for and that I have heard, and this has led to improvements for us, is our wait times are increasing.
Okay.
And this person it took a long time to be able to schedule with somebody in their state. Because what that tells me is we do not have a tight enough connection between our licensing team and
Mhm.
maybe our practice operations team, who has the insight to what kind of license coverage do we need in each state to cover our patient populations? Like, how many clinicians are we going to need to cover a 24/7 operation versus maybe a Monday through Friday business hours operation? So there's a disconnect, and we're basically just kind of licensing, crossing our fingers that it's going to give us the actual business impact that we want. So
I love that.
I
So the wait
cannot stress
time,
enough. Yeah.
yep. And that goes back to your mapping the process. So
Yeah.
organization sees that, they recognize that. Would your suggestion be, so go back to the process and see sort of where there's a holdup?
I think so. And I think that what needs to be built into your process is where in the process do we partner with the operations team to know exactly what that licensing plan for that clinician should be, maximizing our business needs and making sure that we're giving that clinician enough access that they can stay busy.
Love it. Right.
Yeah,
Because they want to see as many patients as they can when they're out there working. So it's
absolutely.
really, that's the win-win for everybody all the way back to time, maximizing your time and utilizing it in the way it's meant to be. Another question for healthcare leaders who know administrative friction is impacting their organization, but may not know where to begin. It's sort of the same topic. What are the first steps you would recommend to identify these hidden gaps and start improving them? And I think Susie just answered that with, wait times, seeing that there's scheduling delays, and then go back to that process. And
Mhm.
where do you partner and how does it look? And you said per clinician, which I wrote down, a licensing plan per clinician. So is that how you have it? Per clinician?
That that's how we operate now. So every single clinician who comes in, we are looking at their individual current licensing.
Okay.
What do they come to us with that we can use within regulatory parameters? How much member access is that going to provide them? And therefore, how much productivity are they going to be able to have and member and patient impact? And if they don't have enough to keep them busy, we're going to be assigning licenses, but we're going to do it very strategically to make sure that we are covering our state geographic needs, and we're providing them a state mix that gives them access to members and patients that will keep them busy.
I love that. And then that goes back to the growth.
Yeah.
And by joining Included Health, having it be such a thoughtful, proactive process for these clinicians, the licensure will be with them forever. So I hope they stay with Included forever. But if they're going to stay in patient care, now they have access to patients in places that they didn't have it to begin with, and they're helping others. Because, something that I know you and I've spoken about in the past, there's a certain number of clinicians. And the fastest way is not to, we need more clinicians, but the fastest way to get more patient care is through licensure. And
Right.
everybody has to look at their bottom lines, which was the large overarching part of our conversation today. But at the end of the day, bottom lines in this land are people. And it's really hard to say that out loud. So how do you take care of your people? And in order to sort of be responsible on the revenue side, but also really end of the day, take care of our patients and take care of our clinicians, who without the patients and the clinicians, none of us are doing anything in our roles.
Yeah, I love that. And I'll just to kind of put a bow on that. I love that you called out, and this is, I think we don't do a great job of communicating this, the value that additional licensing brings to an individual clinician, even if you do move on to a different organization, that expands your value as a candidate, as a clinician, as being able to reach more patients. So I think if there's a clinician on the call or you have an opportunity to communicate with clinicians, helping them understand this is not just about what Included Health needs and like it's only one-sided and we're getting it and asking you to do all of this administrative work. There's a lot of value to you as a clinician to hold multiple state licenses, and your opportunities will expand.
I love that. What a perfect ending. And that the right organizations are also going to provide you the support to carry the additional licensure that a lot of the regulations and things bring with it. But there are tools out there like Mockingbird who will
Absolutely.
help you along your career. Susie, the time flew as we know it would.
I know.
It was really fun to chat with you. And most importantly, your intel and the takeaways that anyone listening to this today or another day, you're phenomenal. And thank you for all of the incredible work you do for clinicians at Included and elsewhere. You are a genius in this space, and you do know how to scale clinicians and make them happy. So thank you.
Well, thank you. And I will say we cannot do it without amazing vendor partners like Mockingbird. So I absolutely value and appreciate the expertise that your team brings as well.
Thank you. I will see you again. Enjoy the beautiful day today.
I will. Thanks.
Bye.